Welcome to the Fiona Stanley COVID-19 Theatre Pathway. Booking cases, Step 1. The surgical team books the case through the base system and contacts theatre front desk. Screening questions are asked by the front desk of the booking team, and the case proceeds depending on the urgency matrix as shown below. Front desk will contact the duty anaesthetist to activate the COVID team, and the COVID theatre is utilised where possible. Step 2. Assessment. Following confirmation of case necessity, the patient will be reviewed on the ward by a member of the anaesthetic team. Digital review of BOSNet notes occur. Assess clean notes and charts outside the room, and please don't take any notes into the patient area. Droplet PPE can be worn within the room and airway assessment completed from a distance. Consent forms should not be touched by the patient and should be verbal where possible. Ensure safe doffing and hand hygiene on exiting the patient area. Step 3. Team briefing. Once the patient has been reviewed, theatre team assembles in the COVID theatre for briefing. The briefing is led by the primary anaesthetist and utilises the briefing checklist. The primary question in the briefing checklist is, does this case need to proceed at the moment? Secondary question is the need for the ICU bed. If no bed available, stop, contact ICU and reassess with the surgical team. Go through the checklist, ensuring all team members know their roles before departing for patient pickup.
So today we're going to be doing a laparotomy.
That's right.
All right. This patient's unfortunately COVID positive, so we've got to take full precautions. Okay. Now, first of all, from my perspective, the patient doesn't need an ICU bed. Are you happy with that?
Same from the surgical's point of view.
Okay, good. Now, have we got everybody here? I'm here as an anaesthetist.
I'm here as the surgeon.
Do you need an assistant?
I do, and he's on his way.
Okay, good. Now we've got a scout nurse, runner, and scrub nurse. Do you need any other nurses in addition? No. Okay. So I'm going to be anaesthetic 1. David, you're anaesthetic 2, and we've got technician 1 and technician 2. Thank you very much. Okay. Now, David, you're going to be the master coordinator. All right. And have we got our runner? Now, how long do you think this is going to take?
An hour and a half, approximately.
An hour and a half?
Yep.
All right. Now, has everybody done their PPE training?
Yes, we
Are you
have.
happy with it? You've fitted your masks?
Yes.
Okay, good. Now, what we'll do now is we'll go through a detailed plan of what we're going to do precisely. Okay.
Discuss the PPE plan for each team member as per best practice recommendations for use of PPE during the COVID-19 outbreak.
Now, at this point, I'd like to say this is the final thing. This could go on for considerably longer than an hour and a half. It's a laparotomy, we don't know how long it's going to take. Can everybody make sure that they have toilet breaks before we start this case? So we'll go and do that now, and then we'll reconvene here in 5 minutes, and we'll go up and start. Okay?
Sounds good.
Thank you.
On completion of briefing, theatre team to request COVID porter to ward location. Utilise the specified COVID operating theatre for the case. The theatre should be cleared of all non-essential equipment, anaesthetic machine and the computer station draped with plastic. A station should be placed in the clean anaesthetic anteroom. Donning and doffing points in the theatre should be clearly located. Anaesthetist 2 and Technician 2 prepare drugs and airway equipment in the anaesthetic room. Take into theatre only what is required for induction and emergency procedures. Scrub team prepare and count in separate theatre anteroom. Donning of PPE should occur just prior to patient contact, and please refer to the Fiona Stanley Department of Anaesthesia PPE guide and use a buddy to ensure steps are correct.
Okay, all right, Carla, we're going to go through this stepwise process. So we'll start with our hand hygiene. Start. Okay, so once we're dry, we'll go to gowns next. Yep. Am I good?
Anaesthetic team and staff coming into contact with aerosolized particles should wear N95 masks. Surgical masks shown here for PPE preservation purposes.
Okay, hood's on. Next thing we'll go to, visors. Visor on the outside. All right, we're good. Okay, gloves. We use our surgical gloves. Happy you've covered? Yep. Okay.
And then double glove.
And normal gloves. All right. Okay. Final check.
Yep.
We're good. Okay. Let's go to the ward.
Step 5. Collect and move the patient. The runner nurse, anaesthetist 1, and COVID porter attend the ward to pick up the patient. Pre-op checklist is completed by ward staff, theatre runner and anaesthetist to allow direct transfer from ward to theatre. Stopping in holding bay is not required. Prior to transfer, old sheets are removed from the patient's bed and a fresh single sheet and red transfer blanket placed as a visual warning during transfer. Ideally, the lowest flow oxygen device is to be used for transfer, e.g. nasal prongs, and a surgical mask must be placed on the patient for transfer to catch droplets. Prior to departure, run a nurse to utilise the transfer checklist.
We have nasal prongs on.
Okay, have we got the appropriate monitoring that's required for her?
Yeah, we don't need monitoring for this case.
Okay, I've got all the paperwork with me. You've got your full PPE. I'm ready to go.
Ensure that equipment, personnel, patient and route confirmation boxes are ticked.
Yeah, and then just ensuring that you're both remaining with the patient and will not make contact with hospital structure, walls, doors, door handles or elevator buttons.
Yeah, that's
Okay? You happy with that?
Yeah.
All right, we're good to go.
All right.
All right, good. Watch your back, Mitch. That's good.
Transfer should occur via normal portering routes and utilise the priority recall function in the transfer lifts. On arrival to theatre, the runner nurse hands off the clean notes to clean anaesthetist. Notes are not to enter theatre during case. The runner nurse can now don gloves to assist with patient transfer. Technician 1, also present in PPE, assists with transfer. Please avoid hover mat use due to risk of aerosolization. Porter discards old linen, cleans bed with Oxivir, doffs gown and gloves in theatre before removing bed and performing final hand hygiene outside theatre in final doffing station. Runner nurse now also doffs and leaves theatre. Step 6. Induction and airway management. Please note, airway manipulation is a high-risk moment for aerosolizing virus particles. Only necessary staff should be present in the room. Please refer to Airway Management Guide for COVID-19 patients for detailed description of the intubation process. Note the time, airway and circuit has been secured. Given current theatre air circulation rates, We have been advised that after 20 minutes, aerosol particles will have been effectively removed and the theatre is safe to enter as per droplet precautions. If possible, the scrub team and surgeon should wait 20 minutes after intubation before entering theatre. This will allow them to wear droplet or standard theatre PPE for the duration of the case, thereby increasing comfort and preserving N95 mask supplies where possible. Should the case require immediate surgical intervention or is of a high-risk type, for example, upper GI endoscopy, ENT surgery, ophthalmology, max fax or dental surgery, the whole scrub team will require N95 aerosol enhanced theatre PPE. Please discuss at the team brief the PPE plan before proceeding. Surgery now proceeds as normal. The doors to the anaesthetic and anteroom can be opened after the 20-minute window, but please keep door opening to external areas to a minimum. The anaesthetic room team should keep and complete the notes in the scrub room. The scrub team can utilise the computer covered in plastic, and the scrub team communicates via a clean runner for pod supplies. Do not use the direct entry into the pod during the case to ensure pod sterility. Once surgery concludes, the bed can be brought in by the scout nurse. The scrub team are to remain in theatre to assist with transfer of the intubated patient to the bed. The slide sheet is disposed of and dirty linen placed in linen bins. The scrub team can now doff and leave theatre. Please note, gowns and gloves are doffed inside theatre. Eyewear, masks are doffed outside theatre. The scrub team performs final hand wash and can now exit the theatre area. Showering and changing scrubs is also recommended. Step 8. Extubation. Extubation is another high-risk time for aerosolizing particles. Minimal staff only in the room, all wearing full aerosol or enhanced theatre PPE. Details of the extubation process are described in the Airway Management Guide for COVID-19 patients. Please note the extubation time and add 20 minutes to calculate the safe entry time. Record this on the theatre whiteboard. Step 9. Recovery. The first 20 minutes of recovery are done by the theatre team already in theatre, in this case anaesthetist 1, to allow for aerosol dispersion. If a short recovery time is expected, the anaesthetist should complete the recovery until patient meets PACU discharge criteria. If an extended recovery is required, a PACU nurse can complete the recovery period wearing enhanced theatre or aerosol PPE in case airway manipulation required. During this time, anaesthetist 2 to remain in the anaesthetic room to complete paperwork and act as backup in an emergency. Once handover to PACU nurse completed, anaesthetist 1 and tech 1 can doff and exit theatre. Please ensure buddy checking during doffing procedure to ensure compliance. Step 10. Transfer back to the ward. Once PACU discharge criteria are met, the ward nurse can be called for pickup and a call placed for the COVID porter. The PACU or anaesthetist are to hand over to the ward nurse. The ward nurse stays clean for transfer and can take possession of the clean notes. No touching of the bed, so no gloves are required for the ward nurse. The COVID porter should be wearing droplet PPE for the transfer, and the patient must be wearing a surgical mask and covered in a clean sheet and red transfer blanket if available. Please read the supporting documents and seek guidance from the anaesthetic team where unsure of roles and responsibilities. Team brief at the start of the case will be key in avoiding confusion and planning for a successful case. Please be aware the COVID process is continuously evolving. Changes will be communicated via line managers. Stay safe and look after each other.